I work in the renal psychology service, but I also work alongside a number of other psychologists that work into different medical specialities. As psychologists, we do quite a lot of work with patients around recording their thoughts and feelings, and one of the hopes that we'd had as psychologists in the department was that perhaps using apps rather than the traditional pen and paper sort of diaries would be a bit of a step forward in our treatments. So we've started to work with ORCHA on this project, and they have been really good at helping us to look at some of the apps that we were already using and help us to evaluate whether they meet a threshold for being acceptable to use with the patient group. But also they've helped us to try to identify some new apps that would be possible for us to use in various different areas where we felt that it might be quite useful. It's been quite interesting in the process because some of the apps that we had previously thought might be quite good for use with our populations actually didn't quite meet the threshold or the criteria that ORCHA used to assess how good the apps are, and that was quite interesting for us to realise that. I think it also helped us to understand that it's not just how useful the app is to us, but also all the background about how the data is used and the security aspects of it, which doesn't necessarily fall within our area of speciality. I think there's quite a lot of dangers associated with using apps that haven't been looked at, and particularly in the area of mental health, because people are very suggestible when they're having difficulties. People are very desperate to have any advice or have any support, and I think ORCHA kind of helps with that because they help the therapist to establish are these safe apps to use, is the information contained in them accurate. So the idea that you wouldn't have a support system around the use of that app I think would be quite dangerous.